Good afternoon, everyone. Before we get started today on some of the other issues we'll be talking about, I do want to share some good news for the state of Missouri this week. We are happy to announce an additional $10.1 million for the A+ Scholarship Program, including $4.9 million in CARES Act funding and $5.2 million in the supplemental funding. COVID-19 has caused many more students to utilize the A+ program than originally anticipated. We are excited to be able to provide this additional funding and help community college continue to provide the full A+ scholarships for all students. And even more good news today. Missouri's unemployment rate dropped to 4.4 in November, with a recovery of 67% of the jobs that we had lost back in the spring of this year. And we are now in the top tier of the United States of America for economic recovery. Shifting back to COVID-19, again, I want to thank Missourians for their efforts over the Thanksgiving Day weekend. I know this Thanksgiving looked very different for many of us, including my own family, but we truly appreciate Missourians making adjustments and taking precautions to protect one another. We can see from our data that these actions are making a difference. We are now well past the 2 weeks marked since Thanksgiving, and we are thankful that Missourians did not experience a surge in cases following the holiday. While we are still experiencing high volumes of cases, our numbers have been stabilizing. And on a personal note, and as the governor, I want to thank all Missourians for taking the action upon themselves, not because of mandates, not because government's telling you to do things. It's taking the responsibility on yourselves. And by doing that during that time at Thanksgiving, and as we go into the Christmas holidays to continue to do the same things, it truly had an impact in the state of Missouri on all of our lives. And we are now at a plateau where a lot of other states have not reached that plateau. And it's because Missourians took action upon themselves and took that responsibility and truly made a difference by doing things differently. And I want to thank everybody for their efforts, and I want to encourage you to continue that. As you know, it has also been an exciting week here in Missouri regarding COVID-19 vaccine. The first shipment of the Pfizer COVID-19 vaccine had arrived and are now being administered to healthcare workers. We have been preparing for this for many months now, and everything has gone according to our COVID-19 vaccine plan. Hospitals across the state have expressed how thankful they are that a vaccine is here and see these first shipments as hope for the future. We have received almost 51,000 doses of the first Pfizer shipment and expect to receive the second shipment next week. We are also expected to receive our first shipment of over 100,000 doses of the Moderna vaccine next week, pending the FDA approval. I know there is already a lot of misinformation circulating, but I want to assure you that this vaccine is safe and highly effective. The vaccines followed all of the standards, all the traditional standards for safety. Both the Pfizer and Moderna vaccines showed 95% effectiveness, which is extremely encouraging. Vaccines will initially be in a limited supply, but we are hopeful that they will quickly become more available as we continue to receive shipments and work through the 3 phases of our distribution plan. Many people have questioned about the 3 phases and when they will be able to get a vaccine. We will continue to communicate with the public about the phases and the vaccine's availability. Our vaccine website, and I encourage everyone to follow this website. Our vaccine website, Mo Stops COVID. Mo Stops COVID is also a great resource to stay up to date and informed on the vaccine and our distribution plan. So we highly encourage all Missourians to utilize this as we move forward. As far as the hospital capacity, we are working with Visit to deploy additional staff in our hospitals. We currently have 6 healthcare systems participating, including SSM Healthcare in St. Louis and Jefferson City, St. Luke's Hospital in Chesterfield, Mozak Life Care, Hannibal Regional Healthcare System, BJC Healthcare, and Cox Healthcare. Those at this time are the 6 hospitals that have asked and have received help with this, providing more staff. We currently have 117 contracted staff, from ICU, RNs to respiratory therapists. The first group of staff is scheduled to begin on Monday, and another 42 staff members will be coming soon. We are happy to be getting more staff on the ground and are hopeful that this will provide some much-needed support for our hospitals. While we are optimistic about the vaccine, this fight is not over, and we cannot let our guard down. Prevention will continue to be critically important, especially with Christmas approaching. Again, this means social distancing, wear a mask, minimize travel, avoid large gatherings, and limit interactions to 15 minutes. Let me just stress those points again. It's not one of the above. It is all of the above. When everybody started doing that over the Thanksgiving holiday, it made a difference in the state of Missouri. We must continue to do that over the Christmas break. Again, you have to take that responsibility upon yourselves to make sure that we can move forward. If we do that, and you make sure and do your part, we will start this curve in a downward effect if we will all continue to do what we're with the help of the vaccine. The vaccine, needless to say, is exciting news, but we cannot let our guard down. We must continue to practice the things we've been practicing. And not only that, we have to do a better job of it. Again, all of the above, not one of the above, all of the above. Government is not going to be out there to make you do all these things every day. You have to take it upon yourself to do this. And we can, and I believe we will, as Missourians. We must continue to be responsible, change our behavior, and take precautions to slow the spread. This, combined with the vaccine, is how we will overcome COVID-19. Thank you, and God bless. Dr. Randall?
Thank you, Governor. And I want to speak to Missourians today as a physician. I practiced for 30 years. In behalf of the 350,000 healthcare workers in this state, just want to thank the Governor. I was out at SSM yesterday here in Jeff City as they were giving the vaccine. And just an incredibly emotional experience, a lot of tears, just people so appreciative. The Governor green-lighted this months ago. People have been working really hard to think about General Perna and Dr. Slowey and all that went into this, our friends at Pfizer, and then getting the vaccine to 50 states. And I just want to walk you through that process real quick, is that once the FDA approved it Friday night, then the Advisory Committee on Immunization Practices has to give the guidelines. Can pregnant women get it? What happens if you miss the second vaccine? If you've had COVID, should you get it? So they put those out Sunday morning. So we were working throughout the weekend constantly, and then put out the standing order by me yesterday. Cannot thank our partners enough. Herb Kuhn is just a treasure. Rich Ludwig and Barnes Jewish and others around the state that we reached out. I was on the phone with them at 6:30 on Saturday morning trying to make sure that we had our plan executed, and it was. It went really well. And so want to just reach out to you as influencers and talk to you just a little bit clinically. We hope every Missourian will consider getting this vaccination. And then people have questions, we understand that. I practiced for 30 years and perfectly expected my patients to have questions. But I do want to address two issues clinically. One is safety. I was with Dr. Peter Marks last week at the White House. The FDA has been doing this for over 100 years, the group that looks at drug and vaccine safety. And they use the same process they always do now. So both the scientists at Pfizer, the internal scientists and external scientists at the FDA approved it, then the advisory council approved it, then the FDA itself approved it, then it got to Missouri, and we looked at it this weekend with various people, and we approved it to be safe. So we very much think this is safe and as the governor said, effective for people with COVID. The other thing I want to address is people say, well, I'm concerned about side effects. So as a physician, let me talk to you about that just one second. If 100 people get this vaccine, 90 will have no side effects. Less than 10 will have mild side effects, more likely to occur after the second vaccine than the first. And they usually go away in a day. They usually develop about a day or two after you get that second shot. And they consist of primarily fatigue and about 4%. You'll feel a little bit tired that day. Headaches, about 2%. And about 1% will have some muscle pain right here and what we call myalgias, muscle aches all over. And 1% will have a little bit of a chill. But again, 90 out of 100 won't have that. So we certainly understand that people are going to ask questions, and we ask for your help in communicating that. The two reasons we hear that people might not want to get the vaccine is they want to make sure that the process was safe, and that they want to make sure the side effects. For bad things happening, more bad things happening in the control group than in the placebo group. So those are exactly the same. You've heard coming out of the UK that 3 patients who had a previous injection and had a very bad reaction, that happened in the UK, not in the United States. And we think that's due to a particular substance in the vaccine. There's no animal, there's no egg. It's a messenger RNA virus. So with that, I'm going to stop and answer any questions, but just greatly appreciate your help as we try to get out the message about how effective and how safe and how much we encourage Missourians to take the vaccine. Kelly?
Hi, Dr. Williams. So a recent poll from the Kaiser Family Foundation showed that those who took the poll, around 71% said they plan to take the virus, or not the virus, the vaccine for the virus. Does the health department or the state have any plans to try and promote this vaccine, to try and make sure that as many people get the vaccine as can?
We do. We have a very robust campaign. And again, if you'll go to our website, Mo Stops COVID, you'll see that. Kelly's working with that. Lisa Cox in our office is working with that. And we're doing that campaign based on listening. We've been doing groups, bringing in advisory councils. As the governor and I often talk about, this is a very diverse state. And it's just natural. You're in the communication business. Different people hear different messages different ways. And so we very much have listened into what different communities might be most interested in learning about it. And that's been very much built into our campaign. But thank you for asking. And I think you're going to be very much a part of that campaign.
Hi, Dr. Williams. Thinking about herd immunity, we've heard a lot about that. And now with the vaccine coming, what exactly, or how much of the population do you think needs to either have the antibodies or have the vaccine to get to herd immunity in Missouri? And when do you think that will be?
Connor, the answer is 75%. We think probably 10% of Missourians have been exposed to the virus. Certainly the ones we've tested, but there's more than that we know. So to get to herd immunity, which would be about another 3 million people, we think, hope, and again, this is all based on, kind of probabilities, that if we could get people to take the vaccine, Tony Fauci, Dr. Slowey, others, think that we could get there by June. We really could, to get to herd immunity.
Dr. Williams, yesterday, Illinois governor said that they were receiving less than half of what they originally planned from the federal government. What does that look like here in Missouri? Are we still receiving what the federal government told us when it comes to the vaccine? And if not, how much are we not receiving?
Yeah, Emily, thanks for the question. You know, one thing the governor's always stressed is we know this is going to be a dynamic situation, and we have to be able to turn on a dime. And this weekend we were doing that. I mean, if you'd asked me Thursday, certain people being included, pregnant women, we would have said probably not. And then again, American College and others said that they were approved. So the answer to your question is that we just learned a very short time ago that we're going to be receiving a little bit less of our second dose of the Pfizer vaccine. And I've got to call into General Perna. I called him about 45 minutes ago to figure out why that is. It's not a drastic amount, but it's a little bit smaller. But I think, you know, as the governor said, this is not unanticipated. That when you're dealing with hundreds of thousands of vaccines, and by February we may well have 2 more, according to Dr. Slowey, they're going to be different developments. But at this moment in time, we have maybe 25-30% less of the second dose of Pfizer alone than we were looking at. But we'll keep you posted on that.
Hi, Dr. Williams.
Hey, Philip.
After Pfizer, Moderna, AstraZeneca is kind of the third leader and a vaccine candidate. How many more do you know of after that, and how effective do they need to be useful? Yeah,
it's an interesting question. I learned this at the White House. Dr. Slowey, who heads Operation Warp Speed, a brilliant man, he looked at, there are more than 100 vaccines being developed all around the world. He picked 6. He picked 6 of the hundreds, and 4 are very much in development. You mentioned AstraZeneca and also the Johnson & Johnson vaccine. And again, as we've said, nothing's for certain, but he told us at that meeting that he anticipated that AstraZeneca and J&J might well be available in February. Not definite, but that was his hope.
Sir, can you tell us sort of an updated time frame on when the general public can expect to see this vaccine, and what factors would speed up or slow that down?
Yeah, I mean, I think again, it's to Philip's question, if other vaccines come on board in February, as Dr. Slowey thinks, but that's not for sure. We have to be prepared to, like the governor says, turn on a dime. And then I think that according to our projections, which are just that, projections, we would hope to move into 1B once we get through with our healthcare workers and our long-term care residents and staff in the next weeks, and then move into 1B, which is 3 million people, and then move into phase 2, which is our congregate living people in prisons and those areas, and then hopefully get to phase 3. Hopefully, I emphasize, in mid-April, and then have a vaccine available mid-April, May, and June. And that reminds me of something the governor just reminded me earlier. You know, one thing that he very much has always been focused on is that we're one of the first states to start the vaccines in our long-term care facilities, and that is not affected by the Pfizer distribution. That's a Moderna distribution. And so when you look at Missouri, 4% of our cases come from long-term care facilities, but 43% of our mortality sadly comes from those. So the governor has green-lighted that, and we're moving on that very quickly. As you know, we do that through Walgreens and CVS. We just allocate the vaccine. They then administer it. But it's up to us. Not all states are doing that. Some states are saying, well, we'll just wait. But I really appreciate the governor being sensitive to that and us going ahead and executing that. Thank you, Kelly. Thank y'all.
Let me add one thing to the question when Dr. Williams would ask about the supply. Nothing that is happening that's not unexpected for us so far. We know when they throw a number out there, it's why we don't say much about numbers, because we know they can change, and this whole thing changes daily. Every day there's new information coming. So the one thing I want to assure Missourians is that we're prepared if the vaccine doesn't come in quantities or if it comes in more. We're prepared for that. We've been working months with SEMA, the National Guard, all the departments in the state. We're well prepared when snow comes. If we happen to have snow and we have to figure out how we're going to deliver it, how we're going to administer it, all of those things are in play across the state. So a lot of departments involved with this, and I am very confident that this procedure will continue to move forward every day.
Yes. Governor Parson, you recently announced a partnership with Vizient for hospital staffing. I was wondering how many hospitals have actually taken advantage of that partnership?
I just covered that in the press release, but 6 hospitals have taken advantage of that out of the state of Missouri. There's about 117 that'll be here on December the 21st that will be here. So far 6 is all that's asked for help in the state of Missouri, but it's open to everybody that needs it. So that's well on pace, and they are on ground, and that process is moving forward also.
Governor Parson, this afternoon, a report from the Ethics Committee came out asking Representative Price to step down and be censored. What is your response to that?
I have not seen anything about any kind of report that's come out. I'm sorry, I don't know what it is.
That's okay. It had to do with sexual relations with an intern here in the State House.
Yeah, I don't know. I haven't heard any of the information on it or seen what's been said about it, so I don't want to make any comment on it.
Yeah, good afternoon, Governor. Two-part question on 2 different subjects. One, I followed up on the Missouri Veterans Commission report with Senator Hawley, and he told me he'd like to see some changes in the veterans' homes. I'm checking to see what the latest is on that. And in October, I asked you about the Children's Division. You said that was one of your top priorities to bring stability to the CD. They've had 6 directors in 7 years. There was a hearing on the hotline yesterday. Is there anything new on that particular post? Thank you.
Yeah, and you must think it's Christmas time and you get to ask 2 questions instead of 1. You worked in there real quick on me, Brian, but good job. Let me first of all, on a very serious note, both of those questions are very serious. The nursing home and the veterans home is something that's very dear to me, being a veteran. Most of you have seen the report that's come out. Things have to be done differently. And we're going to ensure that those changes are made as soon as we possibly can make those changes. The state has stepped in once we've seen that we felt like there was a problem there and have been on the ground ever since. But there needs to be changes made on the operations, and we're going to see that is done.
Okay, switching gears completely, we're going to talk about the vaccine. Do you plan to get it? And if so, when do you plan to get it? Are you getting it soon? Are you falling in the line? What's your plan as governor?
Well, that's probably a plan I haven't even thought too much about myself, but I'm sure there's plenty of people around me that has thought of that for me. I've had COVID-19. So I think my personal view would be I would want to make sure a lot of other people got it before I had to have it. I do realize the importance of being the governor and the vaccine for the obligation I have to the people of the state. But right now I feel pretty comfortable making sure all the frontline people that really need it gets a vaccine ahead of me. And we'll make that decision as we move forward as it comes more available. But that's the way I view it right now. Again, we've had discussions about this. So with that, listen, thanks everybody. I'm not sure, are we doing a press conference next week, Kelly, do you know? You don't believe so? Thank you very much. I wish you all a happy holidays. Thank you for what you do every day, getting the message out to people. There's a lot of things we covered today. And just let me finish by saying this. Please help with the messaging about people need to stay the course and get the right facts and the right information as we go through this process. You, as much as anybody here, can get that message out on a continuing basis for the next several days. That is critical that we maintain the same abilities that we've been doing since Thanksgiving, that we got to work hard. We got to make sure the people of Missouri needs to stay the course for a few more weeks. Thank you very much. God bless.